New at 5, as we keep learning more about coronavirus, doctors now say it can also affect a person's nervous system. Doctors here in Pittsburgh were the first in the country to make the discovery. Dr. Maria Simbra explains how they made the connection in a local man with COVID-19.
In all of the United States, the first documented coronavirus-related case was in a Pittsburgh hospital, a nerve problem called Guillain-Barré syndrome. It typically happens after a viral illness. The immune response attacks the nerves.
This results in progressive weakness, loss of sensations, and in some cases it progresses to the point where patients have trouble breathing.
The patient was a 54-year-old contractor who started getting sick just after his wife was diagnosed with COVID-19.
He was having difficulty breathing, he was running fevers.
He did have the infection with pneumonia and something else.
While he was being treated for his COVID, they noticed that he was getting weaker in his extremities. The patient did have the very characteristic features of Guillain-Barré syndrome.
He was weak, and when doctors tapped with a reflex hammer, no response. His nerve tests and spinal fluid were abnormal and showed he had Guillain-Barré. He ended up on a breathing machine.
He had the dual problems of COVID infecting his lungs and the weakness of Guillain-Barré.
The doctors gave him the standard therapy for this, intravenous antibodies called IVIG. He got off the ventilator, started rehab for the weakness, and gradually improved. Usually, Guillain-Barré happens several weeks after an illness.
This is something unique about COVID-19, that the Guillain-Barré in COVID-19 tends to occur fairly rapidly.
In fact, the same pattern happened in a handful of patients in China, Italy, and France. So for the first American case to be documented in Pittsburgh, which has not been hard hit,
we were quick to recognize it. We do feel that perhaps they are being underdiagnosed. A patient who is being treated for COVID-19 infection, if they develop weakness, the thought should cross their mind that maybe the patient could be developing GBS, Guillain-Barré syndrome.
how they respond to treatment and unusual complications will be important to note. I'm Dr. Maria Simbra, KDKA News.